Hi, welcome back to Student Nurses Success. As we continue our maps on renal disorders, this particular video will cover postrenal disorders. Postrenal disorders have to do with obstructions of urine flow out of the kidney or the bladder. Remember, you can find a link to the maps in the comments section. Let's not waste any time and let's go ahead and get started. So, as we're talking about postrenal disorders, postrenal obstructions lead to something called hydronephrosis. Hydronephrosis is a collection of fluid, urine primarily, inside the kidney. So, what we see is a backup of urine and it starts to collect inside the kidney structures. The problem is as the urine starts to increase and increase and increase inside the kidney, it starts to actually crush the filtration system and damage the filtration system of the kidney. Now, what we want to do is talk about a couple disorders that actually result in obstructions. The first is vesicoureteral reflux. Vesicoureteral reflux is an incompetent, incomplete, or a defect in the ureteral valve. The ureteral valve is located right here. What happens is sometimes the valve is incomplete, maybe it's incompetent, or maybe it's defective. If that's the case, urine should run down out of the kidney through the ureter into the bladder. And it should not be able to go backwards because of the valve. However, in vesicoureteral reflux, there's something wrong with the valve. So urine comes down, flows into the kidney, but it can also reflux and flow back up. So what we see is a backup of urine inside the kidney. This can lead to hydronephrosis, which we talked about up here, or it can also lead to some types of infections. Pyelonephritis, which is an infection in the kidney, and it can also lead to cystitis, which is infection in the bladder. So when the valve is not draining properly, it can be from a congenital defect, most commonly, or something wrong with the valve. It often needs surgical correction, and that'll take care of the problem. Tumors can lead to both postrenal obstructions or intrarenal obstructions. It really just depends on where the tumor is located. If the tumor is located inside the kidney, then what we can actually see is a backup of fluid or some type of obstruction or some type of intrarenal issue. If the tumor is somewhere in the ureters or in the bladder, it can actually press and cause an obstruction of flow of urine back up into the kidney. BPH, or benign prostatic hypertrophy, is a common cause of postrenal obstruction. With BPH, what you have is an enlarged prostate, and this prostate gland enlarges due to the aging male endocrine system. It's a pretty common thing for any male over the age of 65 to have some degree of enlarged prostate. In benign prostatic hypertrophy, as that prostate gland enlarges, you can see that it starts to press or compress on the urethra. When this happens, it narrows the urethra, leading to stasis of urine inside the bladder or difficulty emptying the bladder. Whenever you have stasis or urine that sits in the bladder and is not able to be completely emptied, it's going to increase your risk of urinary tract infections such as cystitis. And also, because of the narrowed urethra, males will have difficulty with frequency, difficulty in emptying the bladder. They may have dysuria and even dribbling of urine. Now, you can also develop urethral strictures. Urethral strictures would just be a narrowing of the urethra. The most common cause of urethral strictures not related to the prostate is repeated sexually transmitted infections that cause scarring and narrowing of the urethra. Now let's talk about nephrolithiasis, or kidney stones. Kidney stones are crystals or stones that develop from the increased production of uric acid or increased calcium oxalate. Now, some people just metabolize uric acid differently, and they are more prone to the development of kidney stones and even gouty arthritis. These stones can lodge inside the kidney, we call that nephrolithiasis, or they can lodge in the ureter's bladder or urethra, and we call that ureterolithiasis. If these stones lodge, it can obstruct the flow of urine out of the kidney or out of the bladder, depending on where they lodge. If they obstruct the flow of urine, then urine's going to back up into the bladder or even back up into the kidney. In these particular cases, we start to then develop stasis of the urine, which increases our risk of infections. It can be infections such as pyelonephritis or cystitis. Patients with kidney stones often complain of back pain, flank pain, costovertebral angle tenderness, and this pain is severe and can come in waves. Treatment is focused on hydration and pain control, and prevention is really focused on hydration. When patients drink a lot and maintain hydration, it allows them to frequently urinate and flush out. However, if they become dehydrated or they don't drink enough, then those crystals have more time to form and they get larger. Kidney stones are extremely painful. That about covers it. And now you've finished up on all your renal disorders. Remember to listen to the other renal map videos in order to learn about intrarenal and prerenal problems.